Hello dear GDC aspirants, especially all the Tamilnadu aspirants. Yes, so we know that MRB Pharmacist notification has been released, and also we are doing the Master Stroke series with a free of cost, especially on YouTube. You know very well that. So we have made so many videos focusing on your examination. So this is also another video which will give you a good clarity on community pharmacy subject. Okay, yes. So coming to the today's Master Stroke series, so I'm going to solve the most important MCQs from the community pharmacy and management, especially from the patient counseling and medication adherence. So on this topic that is patient counseling and medication adherence, so we are going to solve 30 important MCQs in this today's session. Okay, so you know very well, if you have not subscribed this channel, do subscribe and share to your friends. Okay, so let's solve the first question in this series. Okay, so these are the topics we are going to cover: the patient counseling, medication adherence, health screening services in community pharmacy. Okay, so on these topics we are going to cover the 30 MCQs. First question: the benefit of patient counseling is, so what is the benefit of patient counseling? First one, improved medication adherence, improved quality of life of the patients, improved professional rapport. Okay, and all of this. So what was the benefit of patient counseling? By giving the patient counseling, so what is the answer? Yes, all of these are the benefits of the patient counseling. Yes, if you give the patient counseling, better patient understanding their illness and the role of the medication in its treatment. Yes, they know, okay, so what is their disease status and their treatment as well. Okay, and improved medication adherence. So if you counsel, if you give the advices, if you talk with the patient, so he'll understand and he'll improve the medication adherence. Okay, and a more effective drug treatment. Yes, more effective drug treatment, reduce incidence of medication errors, so we can avoid the errors and adverse effects. Improved quality of life of the patient. Yes, and also better coping strategies, medication related adverse effects also we can tell them, and also improved professional rapport between the patient and pharmacist. So these are all the patient counseling benefits. Clear? Yes. Next question. So using which is a useful technique for gaining the confidence of the patient? So by following thing, which of the following is a useful technique for gaining the confidence of the patient? Option A, close-ended questions; B, by understanding the patient needs; C, open-ended questions; and D, looking at the patient's eye. So which of the following technique or which of the following thing will be useful technique for gaining the confidence? Option A, close-ended questions; B, by understanding the patient needs; C, open-ended questions; and D, looking at the patient's eye. What is your answer? Yes, do comment your answer. Yes, let us see. Option C, open-ended questions are a more useful technique for gaining the confidence of a patient. Yes, you can see. Okay, ask the open-ended questions about each medication purpose, what the patient expects. So what the patient is. So by that we can gain the confidence. Okay, clear? So assess the patient knowledge about their health and health problems and medication. Okay, and also other things like how can we assess? So determine their capability to use of the medication appropriately and attitude towards the health problem. So we should assess the capability of the patient towards the disease and the medication, and also we should ask the open-ended questions, and also ask the patient to describe or show how they will use the medication. So thereby we can assess. So by the end of this question, you should understand open-ended questions technique are more useful to gain the confidence of a patient. Clear? Yes. Next question. Yes, so we have already started the MRB pharmacist classes. Okay, from March 2nd onwards, the classes are going on. Okay, if you want to prepare for this examination, just without any doubt, click on the GDC class app download button from the Play Store and do enroll in our courses. Okay, and also we are providing for so many aspirants free of cost. We are providing an online test series by every day 6 p.m. in our GDC class app. Okay, if you want that test, just do enroll in our GDC app through Play Store. Download the app from the Play Store. This how download the app from Play Store. Okay, then click on the batches, then click on the plus icon, thereby enter the code. Okay, enter the code MRB25. So there you get a free online test series for MRB pharmacist by today. Okay, by every day 6 p.m. Okay, next question. The success of counseling depends on of the counselor. The success of the counseling depends on the counselor which thing, whether it is a language, tone, facial expression, knowledge and skill. So on basis of which thing the counseling is going to be success. Okay, which one? Yes, option D, knowledge and skill. Yes, based on the knowledge and skill only. Okay, based on the knowledge and skill only, the person, okay, the counseling is going to be success. Okay, yes, you can see counseling is a two-way communication process and the interaction between the patient and pharmacist. The counseling is nothing but just you are asking the questions about the needs and about the medication and about any other inferiorities are there. Okay, so we need to open-ended questions are there, right? In the counseling, the open-ended question should be there so that the person will deliver, the patient will deliver all his concerns and all his medications so that we can assess the health status. Okay, and yes, so the success of counseling is depends on the knowledge and skill of the counselor. Yes, the counseling, so where we are educating the patient, so based on his needs, based on his health status, okay, that should be improved by the knowledge and skill of the counselor, that is a pharmacist only. Clear? And yes, the first phase of counseling is used for the information gathering. Yes, in the first stage we used to gather the information about his name, age, sex and other medication. Okay, so that's the thing. Next question. Before closing the session, it is essential to check. So before closing the session, what are the things we need to check? Patient understanding, relatives understanding, nurses understanding, and none of these go. Okay, so before closing the session, which means counseling session, what the person, okay, what we can expect and what are the things we need to check? Patient understanding, relative understanding, nurses understanding, and none of this. Okay, yes, undoubtedly it is a patient understanding because the patient should, before the closing the counseling session, okay, we must check, that is a very essential to check the patient understanding, because he only the person should understand how, okay, about his health status, how to take the medication, when to take the medication, okay, and with what to take the medication, such type of questions. Okay, and yes, for that reason, whether the person has understood, whether the patient has understood or not, so in order to check, in order to assess that particular criteria, okay, so we need to ask the feedback questions. We need to ask the feedback questions to understand or to know the status of the patient understanding. Okay, so can you remember what his medication is for? Such type of questions we need to repeat so that we need to confirm the patient understanding. Okay, yes, and other things also we should, okay, we should raise, and during the session we should ask any doubts are there, any new questions are there for the particular patient. If you are having any doubts regarding the medication, regarding the dose, so we should ask the questions. Okay, and also, and lastly, we should end the session by, do you have any questions or any other concerns? So like how we need to close the session. Clear? So that's the professional and polite way to close the session. Next, which of the following is the types of barriers in the effective patient counseling? So what are the hurdles or what are the barriers for effective counseling? So which can restrict the effective counseling? So pharmacist related barriers, patient related barriers, organization related barriers, and all of this. Think what the community pharmacy subject. So this subjects are very general, or it is very applicable. Meanwhile, going to solve these questions, try to applicable to yourself. Okay, so meanwhile reading the questions, become a pharmacist. Meanwhile become the question. So meanwhile reading the question, be as a patient. Meanwhile reading this question, be as a, so try to apply applicable for this on you so that you'll easily solve this question. Okay, so pharmacist related barriers, patient related barriers, so which can become, so patient counseling, who will give the counseling? So that's the thing. So by that you can easily answer this question. All of this. Okay, so all of these barriers, you can see, so all of these barriers in the effective patient counseling, organization related barriers like privacy and trust, policies, procedures, and physical barriers. Patient pharmacist related, if the pharmacist doesn't have any knowledge regarding the medication and professionalism, effective communication, okay, and time constraint and workload pressure, if he had such type of barriers, so definitely the patient counseling won't be successful. Okay, and yes, miscellaneous barriers such as financial distinctiveness and regulatory guidelines. Okay, and yes, coming to patient related barriers, so ultimately literacy, cultural differences, lack of interest, lack of trust, gender differences, physical challenge in patients. So all these factors will become the barriers for patient counseling. Okay, so meanwhile giving the counseling, we should focus on this area, so then only we prepare accordingly, we should give the counseling to the patient. Okay, yes. Next question. In the counseling content, the points which are covered except. Okay, in the counseling, the points which are covered except the name and strength of the medication, how to take the medication, what if dose is missed, and description about the doctor. So, which are essential in the counseling except one. So, that's where they are asking. Okay. So, I think last one is option description about the doctor. So, we no need to know about the complete description about the doctor, but we should know about the name and strength, how to take the medication, and what is the dose. Okay. So, these are all the counseling content: name and strength, how to take the medication, what to do if dose is missed. Okay, and other parameters we need to look for in the counseling content. So, you should know about the important things which are important to his health. Are you getting my point? Okay. So, he don't need to know about complete details about the doctor, but he should know about the medication that he is going to take for. That's it. Next question. Patient counselor should first start with, yes. So, when you are going to give the counseling for the patient, okay. So, what you need to start with? So, first of all, so name of the medication, take the name of the relative, take the name of the treatment, introduce him or herself to the patient and greet them by name. So, what is the answer? Yes, first of all, first and foremostly, for any of the session, for any of the interaction, we should introduce ourselves with the patient, okay, him or himself, okay, and then greet them by name, so that the patient will feel positive, okay, clear, and the trust going to be increased in such a way. We need to greet them, okay. Yes, so introduction, counseling is a two-way communication process and interaction between the patient and pharmacist. Yes, first of all, the pharmacist should introduce him or herself to the patient and greet them by name. It's the best use such as Miss or Mr. and such type of titles to be used. Okay, and also we should properly identify and we should properly tell identify the purpose of the particular session very clearly. Okay, we should intimate them. So this session is for mainly to precisely we should intimate to them. So this counseling session is mainly to deliver on basis or to focusing on this thing, so that he will also get attention and he'll become alert. Okay. Next question. Patients taking glimepiride should avoid using. So drug interaction. So glimepiride is an anti-diabetic drug. So that which drug should not be taken along with glimepiride? Option A, benzocaine topical gel. B, hydrocortisone gel. C, diclofenac topical gel, and D, option D, all of this. What is the right answer? Yes, diclofenac topical gel should not be taken because the drug interactions. Patients taking glimepiride should avoid using diclofenac topical gel as it may reduce blood sugar levels in a great extent. As well as antipsychotic, clozapine, thiazide, diuretics, and corticosteroids may reduce the efficiency of glimepiride. So for the reason, you should know. So the main aim regarding this question is we should educate the patient regarding the drug interactions. Okay. So what are the things to be avoid meanwhile taking the medication? Okay. So that for that reason, so we should avoid the diclofenac gel meanwhile taking the glimepiride. Okay. Yes. LAMA stands for. Okay. Generally, what is the LAMA stand for? Okay. LAMA stands for muscle relaxant. Like how we used to have a short abbreviations for the drugs as well. LAMA stands for long adrenergic muscarinic antagonist, long-acting muscarinic antagonist, long-acting muscarinic antagonist, agonist and antagonist, and leave on medical advice. Okay, so what was that? Okay, yes, let us see. It is none other than long-acting muscarinic antagonist. Long-acting muscarinic antagonist. Okay, so this LAMA are mostly LAMA or LABA, long-acting beta agonist or long-acting muscarinic antagonist. So these are mainly used in a specific disease like chronic obstructive pulmonary diseases. Okay, so where this particular disease caused by the respiratory irritants. Okay, so in such cases we should use LAMA or LABA. That's it. Next question. Antiretroviral stored at a temperature not more than, because every dosage form should have a shelf life based on the temperature. So antiretroviral drugs, option E 5 to 10 degrees centigrade, 10 to 15 degrees centigrade, 20 to 25 degrees centigrade, and 25 to 30 degrees centigrade. So what was the temperature here? What is temperature? Yes, 25 to 30 degrees centigrade. They require 25 to 30 degrees centigrade because you can see ritonavir is an example, and the most of the antiretrovirals need to be constantly stored in a controlled temperature and humidity conditions at not more than 25 to 30 degrees centigrade. For example, all the ritonavir capsules should be stored in the refrigerator to maintain this temperature. Okay, even while traveling also they should be carried with the cold bags, otherwise the drugs get deteriorated, the drugs get spoiled. Next question. COPD is associated with. So, skeletal muscle dysfunction, treatment with bronchodilators, muscarinic agonists, and tachycardia. Okay, you should eliminate main important two elements here. Two options you can eliminate: tachycardia and skeletal muscle dysfunction, because it is not at all related to that. Okay, so tell me the right answer. COPD is associated with. Okay, yes. Treatment with a bronchodilator. Clear? So you can see the chronic obstructive pulmonary disease, just now we have discussed, it is an inhaled bronchodilators including LAMA and LABA. Okay, and regular daily use of this LAMA or LABA can improve the lung function. Okay, and dyspnea and health status and reduce exacerbations. Clear? Yes. Next question. Which of the following are signs and symptoms commonly associated with asthma? Which are the following are the signs and symptoms commonly associated with asthma? Shortness of breath, chest tightness or pain, coughing or wheezing, all of this. So definitely the option will be all of this, because whenever asthma is there, these are all the symptoms: shortness of breath, chest tightness, and wheezing when inhaling, so while exhaling, and common sign of asthma. And also sometimes people may suffer with trouble in sleeping caused by the shortness of breath, coughing and wheezing. Okay, and wheezing attacks also affected. Clear? In such conditions like cold and flu. So we know that the symptoms of asthma. So yes, those who want to prepare for the MRB pharmacist, okay, if you want a good quality material from our end, so try to get this material from the GDC class app. Okay, so both theory as well as objective we are providing. Okay, that are mostly covers all the syllabus, and as well as we are also providing the online test series, 200 plus premium test and 35 plus mini tests we are providing. So that's also available in our GDC class app. And also a crash course already started on March 2nd. Clear? Yes. So do enroll if you want to crack this examination. Next, which of the following products were the first to require PPI? Which of the following are the first product to require a PPI? That is formoterol inhalators, budesonide inhalators, fluticasone inhalators, isoproterenol inhalators. So which one of the following products require PPI? Yes, isoproterenol inhalators. So first PPI stands for patient package insert, which means nothing but a leaflet. Let us say, in simply leaflet should be there. So that includes all the that should disclose all the information related to the dose, medication, and all the parameters, care and drug interactions, adverse effects. Okay, so because you can see in the 1968, US FDA realized that need of PPI first time for the isoproterenol inhalation, and it is mandated that sorry, there should be a short warning that excessive use could cause a breathing difficulty. So that's the reason. Okay, first package insert includes these precautions regarding the isoproterenol. Okay, then second PPI are mentioned by the FDA in 1970 for specific drugs with combined contraceptive pills. So firstly, they have mentioned this PPI is an important for the isoproterenol. Secondly, they mentioned for the contraceptive pills. Okay. Yes. For patient package inserts. Next, patient information leaflets are provided by either doctor, pharmacist, marketer, or manufacturer. Patient information leaflet, just we have discussed. Okay. So undoubtedly, the manufacturer should provide that leaflet. Okay. It is a technical document which comprises of all the information or written information of this medication, which includes all the drug dose, medication, okay, and other suggestions regarding the medication. Okay, and yes, pills are provided by the manufacturer. Patient information leaflet or pill, they are known as. Okay, they should be provided by the manufacturer. Next, Which set of rules outline the provisions related to the package insect? So we have discussed just now package, patient package insect, PPI. So they are outlined by the which rules or which provisions? Either Drugs and Cosmetics Act or Drugs and Cosmetic Rules 1944, Drugs and Cosmetic Rules 1945, Drugs and Cosmetic Rules 1946. So which year or which act? Yes, 1945 Drugs and Cosmetics Act rules okay, made the provisions for the PPIs. Okay, you can see all of these provisions. So in the India, labeling and packaging information of drugs under the section of 6 schedule D2. Okay, and thus in the 6.1 label should conform as per the specification and Drugs and Cosmetics Act 1945. So that 1945. Okay, so that leaflet should contain all this information: posology, method of administration, contraindications, pregnancy, lactation, all this. Okay, all information should be included. Next. So which section of the regulatory guidelines sorry, guidelines which section of the regulatory guidelines outlines the pharmaceutical information that should be included in the package insert? Just now we have came across this question. 5.1, section 6.2, section 6.3 and section 6.1. Just now we have came across, undoubtedly it is in section 6.3. Okay. 6.3, it includes the PPI use in India and other countries. 6.3, in that it contains all these things: list of excipients, incompatibilities, shelf life in the medical product as packaged for storage, a sale, shelf life, special precautions and instructions. Next, sustained release and long-acting medication. So what is the purpose of the sustained release and long-acting medications? To increase the frequency of dosing, affects the frequency of dosing, decrease the frequency of dosing, not affect the frequency of dosing. Okay, sustained. Okay, so ultimately the option C is correct. So because no need to take the frequency, no need to increase the frequency, because once you take any sustained release or delayed release tablet, that will release the drug in a very long acting manner. Yes. Strategies to overcome non-adherence. Yes, basically to overcome the non-adherence, okay, drug dependence. So the formulations such as sustained release and long acting release medications are used to decrease the frequency of dosing, thereby to overcome the non-adherence of the medication. Clear? Next, what is the key link between the treatment and the outcome in the medical care? So what is the key between the treatment and outcome? So in order to get a good outcome by the medication, what are the key link? The treatment adherence, medication side effects, physician expertise, patient demographics. So what are the link? Undoubtedly the treatment adherence is a key link between the adherence to the treatment, is a key link between the treatment outcome and the medical care. So that's how. So treatment adherence is important. Next, which of the following is the role of pharmacist in medication adherence? So to give you the medication adherence, so what is the role of pharmacist? He should improve the communication skills, check the patient understanding, monitor the side effects and beneficial effects, and all of this. So what is your option? What is your call? Yes, undoubtedly all of these options, the role of pharmacist in the medical adherence: be friendly and approachable to the patient, improve the communication skills, check the patient understanding, monitoring the side effects and beneficial effects, and speak the same language of patient if possible, so that he or she feel comfortable. Okay. Yes. Next, the consequence of medication non-adherence are. So what are the consequences in non-adherence medication? Poorer health outcomes, high health care expenditures, decreased quality of medication, or all of this. Okay, so all of these are the consequence of non-adherence to the medication. Okay, these are all poorer health condition. If a medication is non-adherence, okay, poorer health outcomes, increased utilization of healthcare resources, high healthcare expenditures, decreased quality of quality of life. Okay, and yes, overutilization of drugs leads to adverse effects. Okay. Yes. Next, which of the following is a factor influencing the non-adherence? Which of the following factor is influencing the non-adherence? Prescription related problems, factors, health system related factors, doctor related factors, and all of this So what are those factors? Okay, what are those factors? Yes, let us see. All of these are the factors that influence the non-adherence. All of the factors, you can see, these are all factors: patient related factors, disease related factors, doctor related factors, prescription, pharmacist, and health system. These are all factors which can affect and influence the non-adherence. All these factors like age, education in the patient, disease conditions like worse prognosis, okay, and some other diseases may affect, and too many drugs, okay, and pharmacist and health system. So these are all the factors. Try to remember. Next question. What does the polypharmacy means? What do you mean by polypharmacy? Are the single medication use of multiple medication by an individual, complex medication regimen, and medication management therapy. So what is the right answer here? Yes, use of multiple medication by the individual, medication, multiple, polypharmacy, medication, polymedicine, polypharmacy, or multiple medication. Okay, yes. So polypharmacy refers to the concurrent use of multiple medication by an individual, multiple medication by the individual. Clear? It is often involving the complex and potentially excessive medication regimen. Clear? Yes. Next, blood sugar between is considered as a dash is considered as a level of 1 hypoglycemia, less, okay, low sugar. So, but what is a considered level for considering as a low sugar levels or hypoglycemia? 30 to 50 per mg, okay, and 44 to 69, 54 to 69, 70 to 100. So what is standard value? Yes, 54 to 69 is a level, considered level. It is as an hypoglycemia, okay, hypoglycemia, low blood sugar and high blood sugar. In generally, the low blood sugar is considered at 54 to 69 mg per, okay, DL is considered as a level 1 hypoglycemia. Clear? Yes. Next, which of the following is a principal screening test for detecting anemia? So how can we detect the anemia? Either by the hemoglobin concentration, hematocrit, hyperuricemia, or both option A and B. So what is the option here? Okay, let us see. Option A and B, by hemoglobin concentration and hematocrit, by the hemoglobin concentration and hematocrit. So you can see major cause of iron deficiency anemia include inadequate iron absorption and dietary deficiency, malabsorption increased by the physical demand. But this can be determined by the hemoglobin concentration as well as hematocrit are the basic two principal screening tests to identify the anemia. Okay, so you can see the differences in the anemic condition, normal blood as well as anemia blood. Fewer red blood cells are there, low hemoglobin is there. So that's how we identify the anemia. Next, which test is conducted to assess the risk of developing cardiac disease? So which of the following tests can predict the risk of cardiovascular disease? Hemophilia test, sugar test, lipid profile, none of this. So which test can predict? Yes, undoubtedly lipid profile is a test where you can detect the risk of cardiovascular disease. So it is also known as cholesterol test, coronary risk panel, okay, and where it can assess the amount of cholesterol, that is good and bad triglycerides in the blood. So this test is conducted to assess the risk of cardiovascular disease, CVDs. Okay, so based on that we should suggest the medication to the patient. So based on the levels of triglycerides in our body, so this comes under the lipid profile test. Next, what are the two methods for measuring the blood pressure using a sphygmomanometer? Either auditory or visual methods, palpatory and oscillometric methods, oscillatory and visual methods, and palpatory and oscillatory methods. Okay, so what are the methods? Undoubtedly option D is correct, because palpatory. So in general, how we test? Okay, by the palpatory method and oscillatory method. Okay, so by check the pulsation as well as the heartbeat. So those are both palpatory and oscillatory method. Clear? But this is used by it is determined by the sphygmomanometer. Do remember this instrument as well. Okay. Next, which measurement is commonly used to define the obesity based on the person weight and height? So which of this can define the obesity based on the person weight and height? So either weight circumference, hip to waist ratio, body fat percentage, body mass index. Okay, yes, undoubtedly BMI, body mass index, is the measurement where we can assess the person obesity based on its body weight and height. You can see body mass index is defines the obesity person's weight and height used to calculate the body mass index. Okay, and it is calculated by this formula. Okay, in short terms it is called as BMI. Okay, yes. Next, what weight status is indicated by a BMI ranging from 25 to 29.9? That is underweight, normal, overweight or obese, because this BMI has a standard values to assess a person's obesity based on its weight. Okay, so yes, he is considered as a overweight. He is considered as a overweight. So because you can see these are all the values. These are not weight. Okay, so these are BMI values. Clear? If the BMI value is 25 to 29.5, he is overweight, and 30 and above obese, 40 and above are excessively obese. Clear? So that's it. And next, what is the desirable range of LDL, low density lipids? Okay, cholesterol according to the lipid profiling guidelines: 60 to 130, 130 to 159, 160 to 189 and 200 mg. So what was that standard value? Okay, so let us see. Undoubtedly 60 to 130 mg is a value where we can see the LDLC, okay, LDL cholesterol level. That should be desirable, should be that is a desirable standard value should be 60 to 130 grams per ml. Okay, 130 mg. Clear? Yes. And coming to the last question of this series, screening results must be provided to the patient in verbally, non-verbally, rating and all of this. So how we should submit or provide the results of screening test? Yes, undoubtedly option C is correct, because we should give them a written document, so that's a proof. Okay, yes. So guidelines for screening services. Okay, so results should be provided to the patient in a written form or documented evidence. Clear? So this is for today's session, dear aspirants. Okay, and yes, so you know very well we have already started the MRB classes, MRB online classes. Okay, MRB online series for the Tamil Nadu aspirants, and also the class are already going on because we have started from the March 2nd as well. Okay, so hurry up and do enroll in our classes, then definitely you will get this job. Clear? Have a great day. Thank you. Jai Hind.